Hello, this is Catherine Marie, and you are listening to Long COVID Real Talk podcast. I have noticed that one of the episodes that is the most popular is the one where I go over my medication that I'm taking. So I was going to do it again just because some of the things have changed that I've been taking, and I wanted to make sure that everyone had the most up-to-date list. I'm going to go through everything that is prescribed and then also over-the-counter things. I want to stress here that although I am a nurse practitioner and I can technically prescribe medication, a lot of this stuff is not really known yet. There are still studies being done as to what helps. The purpose of this is to give you ideas, and then you can ask your provider if they feel that it would be appropriate for you to start. And I guess I just want to demystify all of this for you because, like I said, I could prescribe whatever, but I don't know really what medications are the absolute best. This is just a combination of different things recommended by different people, and I'm constantly changing and trying this and trying that. So I'll try to go through each thing and talk about why I take it, how I take it, and where I get it, if it's not over the counter. So okay, so first let's go and do the medications that are prescribed, because that's easy. I'm going to sort them here. Okay, so the first medication that's prescribed is Wellbutrin. Wellbutrin is also known as bupropion, and originally I was on a much smaller dose before I got long COVID, but long COVID made my depression worse, and therefore my doctor had to increase the dosage of the Wellbutrin. So that is one of my medications, is Wellbutrin. So I'm going to put those. Okay. The next is Prozac or fluoxetine. Again, I was on a very low dose of this originally, and when I got long COVID, I ended up having to increase my dose. So I do really like it for depression and also anxiety. It just kind of takes the edge off. So my provider prescribes that. So Prozac is also known as fluoxetine, if I didn't already say that. The next medication is Adderall. I have ADHD, and Adderall is what is used for that for me, what's prescribed. I've also heard of some people using stimulants, which Adderall is a stimulant, to help with with daytime sleepiness with long COVID. For example, a stimulant like Adderall or nicotine patches, nicotine gum. I have tried the nicotine patches and nicotine gum. There was a study that was done that showed, I think the sample size was very small, but it showed that people's symptoms drastically improved. It's hard for me to say whether they drastically improved. I stopped doing the nicotine, but I did try it. Okay. Another medication that I'm prescribed is metformin or glucophage. Metformin is usually used for diabetes or prediabetes. I don't actually have prediabetes. This is prescribed to me because when I was first diagnosed with long COVID, shortly thereafter, I was talking to my primary care provider because we had both seen this study that said that people that were on metformin were less likely to develop long COVID after they got the acute COVID infection. So I thought, okay, well, just in case I get COVID again, then being on metformin, maybe that'll help me. And I don't know, but it's all of these things you just kind of take with a grain of salt because everyone's just kind of doing the best they can. And all of these studies that have come out, it's just so hard to know exactly what's perfect for everybody. And I'm only taking one tablet in the morning, which is a really, really, really low dose. I don't know if it's even sufficient, but that's another one that is prescribed. Okay, and then another one is a birth control pill, Adgestin. And the reason why this is prescribed is because I originally noticed right when I first was diagnosed with long COVID that during menstruation, it was way, way, way worse. And it was almost like I had a flare up for a week or two every time I had a period. And it was just so frequent. And I had to sleep so much that I went to go see my OBGYN and they recommended this medication. So this helps you not have as many periods. So it just helps with the hormone fluctuations and not having big episodes of PEM or whatever because of your cycle. Long COVID affects the hypothalamic pituitary axis, which is the same pathway that is used for menstruation. So they are definitely connected. So this medication, I've been very pleased with it because it has decreased the amount of, or the number of menstruations per year, and then therefore decreased the amount of, what am I trying to say? The amount of symptoms and episodes of a flare around menstruation. Okay. The next one that I take for long COVID is Singulair or Montelukast sodium. And the reason why I take Singulair, it's taken in the evening. It's a mast cell stabilizer. And because a lot of us have mast cell issues, I really thought that this would be helpful. And my doctor agreed. Okay, the last two prescribed ones. Okay, so aripiprazole or Abilify. Aripiprazole or Abilify is technically, don't get scared, but it's technically a second generation antipsychotic. But it is used for, I hate the name of the group of meds because you don't have to be psychotic to be prescribed them. It sounds, I don't know, I just feel like it's not a good representation of what it's used for. But Abilify is used for treatment-resistant depression, but also it's used for chronic fatigue at low doses. So usually, I believe that usually it started at 5 or 10 milligrams, but when you're doing it for chronic fatigue, the chronic fatigue clinic, they start you off at like zero point 0.1 liquid or something and gradually titrate you up to 2 milligrams. Or you could do what I did and just do 1 milligram first and do half a tablet and then eventually go up to 2 milligrams. And that has drastically helped with the crying and the just feeling like, oh my God, my life is over, that sort of thing. So it has been a game changer, and it has been helpful to other people who I know with long COVID as well. So that's aripiprazole or Abilify. I take the 2 milligrams in the morning. And then finally, we have the low dose naltrexone. This is it originally was prescribed by the long COVID clinic. And then when I went to the chronic fatigue clinic, they took it over and increased the dose. So the original plan was for me to be up to 10 milligrams of low dose naltrexone. I was currently at 5, or I was at 5 when I went to go see the chronic fatigue clinic. And they said, okay, we want you to go up to 6, 7, 8, 9, 10, and 10. And then so low dose naltrexone, if you don't already know this from doing it yourself, you have to go up and titrate really, really slowly. So you go up 1 milligram or 0.5 milligrams even every 2 to 3 weeks. And it can make your head feel really weird. You can get a headache. It's just a weird feeling that you can get with it sometimes. But usually it subsides in a day or two, so when you go up. So I had tried to go up to 10. I couldn't make it past 7. Every time I went up to 8, I started to have headaches and just really, really, really tired in my head, just really foggy and fuzzy. So I am staying at 7 milligrams of low dose naltrexone. Also, I have to get this medication specially made at a pharmacy that formulates their own pills, because low dose naltrexone is pretty cool. I recommend listening to the episode on low dose naltrexone on the podcast Long COVID MD. She does a fantastic job of explaining exactly why, on a molecular level, low dose naltrexone helps so much with long COVID. But usually, naltrexone is used to stop alcohol use, but at a very, very low dose, it can help with nerve inflammation. And when the pharmacy, so you have to send the physician has to send the prescription to a pharmacy that specially formulates the pills. Usually naltrexone comes in 50 milligrams, 100 milligrams. But with the very low dose, you're starting at 0.5 or 1 milligram. So they have to reformulate it and make their own little tablets. So it's kind of annoying because low dose naltrexone is at this point pretty widely used, as far as I know, for long COVID treatment and chronic fatigue treatment, but it's not approved by the FDA for. I believe it's not approved for the FDA by the FDA, and therefore is not covered by insurance, and therefore you have to pay for it out of pocket, and it's pretty expensive. I think it's $100 some for 90 days of it, or 150, something like that, for 90 days. So it's a lot. But you guys understand all that because a lot of the stuff that we're taking is not covered by insurance, right? Okay, so next I wanted to go into the over-the-counter medications that I'm taking. So this is a separate category. These are medications that you can buy over the counter. You don't need a prescription, but I still want to caution you against just taking them because I'm taking them. I really, really recommend that you speak with your provider to make sure that it makes sense for you to take the medications. This is just to give you ideas. Um, and I don't know what medications you're already on, and sometimes you can't take certain medications together. So even over-the-counter medications. So, okay, that's my disclaimer. So the 4 medications that I take over the counter, one is low-dose aspirin, just the baby aspirin. The reason why I take it is it's more just my own opinion. Um, I think there was a study done where they found that a baby aspirin did not prevent strokes. And so a lot of doctors and providers have stopped telling people to take low dose aspirin to prevent strokes and clots. But I have been very afraid of the clot, uh, just the idea of long COVID causing clots. So I started taking low dose aspirin when I realized that I was pretty sure I had long COVID. The next one is technically over the counter, but was recommended by the chronic fatigue clinic. I'm taking it as directed by them. And that is famotidine or Pepcid. The tablets that I bought over the counter are 20 milligram tablets, and the chronic fatigue clinic recommended 40 milligrams or 2 of the 20 milligram tablets twice a day. Now, famotidine is used in the chronic fatigue clinic and long COVID. It's used because it's a histamine blocker. But famotidine or Pepcid is also used for GI symptoms, gastrointestinal symptoms, especially GERD, gastroesophageal reflux disease. So you might already be on it because of that. So again, really important to talk to your doctor about these things and to determine whether or not it's appropriate for you to be taking them. And if so, at what dose is best. So the next one is, yes, that's Pepcid / famotidine. And then the next one is Zyrtec or cetirizine, 10 milligrams. I just take one once a day for allergies. And then finally, I have Flonase or fluticasone. I have the Sensimist allergy relief, so it's a little white and blue spray bottle. The allergist that I went to go see recommended Sensimist specifically, Flonase Sensimist. It is a glucocorticoid, so it is a steroid that you spray up your nose, but you can take it regularly every day. When I used to work in an ear, nose, and throat office, the surgeon who he specialized in the sinuses. He would recommend if you had a lot of sinus issues to do two sprays twice a day, but usually it's recommended to do 1 spray twice a day or 2 sprays once a day. So that's for Flonase or fluticasone, and that's for congestion. Okay, so the next section are the meds that were recommended by other people that I'm taking currently. So one of the providers who does the long COVID clinic at the other facility that I go to had recommended Mitocore, Mitocore, and it is basically a vitamin specially formulated for the mitochondria. And as you probably already know, the mitochondria is the part of the cell specifically that is messed up by long COVID. So it's supposed to help the mitochondria. And then the other one that was recommended in the other long COVID clinic was Tolavid. I believe it's Tolloivid. Tolavid. And Tolavid is supposed to help strengthen your immune system. I am out of it right now, but usually I take 1 tablet twice a day. And then if you're having an acute infection, they recommend, I believe it is 4 tablets 4 times a day. I believe it's on the bottle. I've been trying out lion's mane because a friend of mine also has ADHD and he recommended it. So this is not particularly for long COVID, but I'm just trying it out. And then these last two here were recommended by a long COVID clinic in Texas. The first is L-carnitine, 500 milligrams daily. And then the other one is called Honopure by EcoNugenics. And you start with once a day, and then you increase to twice a day, and then you increase to 3 times a day. And honestly, I'm not sure if they've done much, but I'm taking them because they were recommended to me by a physician. And then the last group are the medications that were recommended by an herbalist. So this is a little more tricky because, again, you could take supplements out to wazoo. There are just so many supplements out there for so many symptoms of long COVID. I was looking specifically for herbs or medications or whatever that help with stress, because with long COVID, at least how I am experiencing it, my temp is always elevated. My blood pressure gets elevated quickly, although it's been normal since I started taking these medications, the ones that chill out your nervous system. But I again I I just listened to a podcast and decided to try them out. So I'm not saying that you should be on them. I'm just telling you what I'm on. And I strongly recommend that you talk to your provider about them before you would take them as well. So the 5 that were recommended in another podcast that I was listening to, that help with keeping you more calm and stimulating the parasympathetic nervous system, are ashwagandha, rhodiola, schisandra berries, panax ginseng extract, and eleuthero. So those are all of the medications that I'm currently taking. Honestly, I don't know if I'm going to keep doing the lion's mane, the L-carnitine, the Honopure, and the 5 supplements for stress support. But I definitely wanted to make sure that everybody who does not have a long COVID clinic near them and they're just kind of trying to work with their primary care provider, that you know everything that I'm taking. So that way, since I have multiple people from multiple clinics with, giving recommendations, that that it can help you kind of piece together what might be best for you. But again, if you really need to talk to your primary care provider before changing anything that you're on, okay? Because I don't know the meds you're on, and I wouldn't want to do anything or wouldn't want to recommend anything that could harm you. So, but at the same time, I wanted to make sure that for all the people that don't have the long COVID clinics, that you have a clue as to what is being done in the long COVID clinics, so that you can just talk to your doctor and see what they say and if they're willing to give it a shot. Because a lot of providers don't want to prescribe things unless they're FDA approved for something, but there is such a lack of research right now. There's a lot of research in progress, but there's not a lot of stuff that is a proven, actually, there's nothing that's a proven treatment for long COVID. So we're just trying to kind of just carry on as best we can until we get the results from additional research. So anyway, this was a really long one. Thanks for listening, and I hope you find it helpful. And if you're taking other things that you think have been helpful, please let me know, and I would love to find out so I can look into it a little more. Okay, that's it for now. I hope you have a good one. We'll talk soon. Take care. Bye.